I am real excited to share with you some really new things that are going on in our profession on a national level. And so, as we think about the whole body and understand that the gateway to the whole body is, of course, the mouth, and that's our specialty, then we begin to realize that our role in our patient's complete health is critical. And there's so many aspects of it that are critical. And I want to talk about that tonight as we talk about integrative dental medicine and the future of complete dentistry as we've learned together through the Dawson Academy. And I want to update you on something that's happening because 2 weeks ago, tonight, I was in Chicago, Illinois, and we had a symposium at the ADA headquarters on Michigan Avenue, whereby the president of the American Dental Association from last year, George Shepley, and the current president and president-elect all invited me to be the program chair for a 2-day symposium on dentistry's role in complete health. It was a landmark event because nothing like this has ever been done through the ADA. And I feel strongly that if we can get the ADA involved, then we've got something really special that we can build on. And I want us and the Dawson Academy to be on the front lines of this movement that's happening. This all came about for me because I got a phone call from Dr. George Shepley. And George last year was the president of the ADA, and he had a real passion about informing the public more and making a concerted effort to attack this sugar problem that we have in the United States. And he called me and asked me to be on a presidential task force. And so last year and now this year, we've been meeting once a month on an hour-and-a-half Zoom call with key leaders in the ADA, as well as some researchers that are involved as well. And it's been a tremendous opportunity to build relationships with those that are in the leadership role of our largest organization in dentistry. George kicked this off with this task force, and then the other members of the task force are Dr. Raymond Comia, who's the executive director of the ADA, the current president, Linda Egger, and the president-elect of the ADA, Dr. Brett Kessler. They all are completely committed to dentistry being seen as a specialty of medicine and building that relationship of collaboration between dentistry and other medical specialists. And so this symposium that we had 2 weeks ago was a first and a beginning of something that is going to continue and build into a national movement. So I'm so excited because this has been my passion for the last 10 years, and to have this breakthrough now as a initiative of the American Dental Association is a phenomenal thing, and I'm just so grateful. And so what I'd like to do tonight is I want to talk to you about this subject of integrative dental medicine and the future of complete dentistry. But I want to share with you a 45-minute presentation that I gave at the ADA symposium 2 weeks ago to all the powers that be at the ADA, along with other dentists and physicians that were there, nurse practitioners, dental hygienists that were at this symposium at ADA headquarters. And so let me share that with you. Some of this information I've shared with you before, but I want to just set the stage for a couple of things that we have coming up in the Dawson Academy in the next coming months that I want to invite you to be part of. And so my background is that around 2011, I was having dinner one night with Dr. Pete Dawson, and we were reviewing all the frontiers of dentistry that we have experienced, that he really, of course, was the leader of so many things that related to periodontal therapy and complete restorative dentistry, complete examinations and treatment plans. And then we go into digital dentistry and implants and so many frontiers that we've moved through in the last 40 or 50 years. And so in 2011, Pete and I were having dinner one night, and I said, it's so exciting to look back over all that's happened in the last 50 years since you have been, a leader, the leader in dentistry. What do you think is the next frontier? In his very Socratic way, Pete looked at me and he said, go find it, and turned it back over to me as a challenge. And so that year, I was invited to a meeting of a new academy called the American Academy for Oral Systemic Health. And the meeting was held at the Cleveland Clinic, and the presenters were researchers, physicians, and PhDs from the Cleveland Clinic. And they were talking about total health and the chronic diseases that we see in the United States, whether it be diabetes, cardiovascular disease, Alzheimer's, kidney, liver disease, and obesity, etc. And one of the themes of that meeting that we heard from every speaker that presented to us was the subject of inflammation, particularly systemic inflammation. And the closing speaker, Dr. Michael Roizen, who's the medical director at the Cleveland Clinic Wellness Institute, he stood up and he said, we have a health crisis that's destroying our nation. It's going to bankrupt us both financially and health-wise. And we only have two options. One is we can ration healthcare and limit access to healthcare, or the second option is that we can become rational as a nation. And that means that we each take personal responsibility for our own health. We don't depend on our doctors, but we are proactive in our lifestyle, which is the key to preventing the typical Western chronic diseases that we see so rampant. And he concluded his presentation by saying, I believe that dentists should be on the front lines fighting the health crisis that is destroying our nation. And when he said that, it was almost like he put his hand on my head. And I thought to myself, we found it. That's the next frontier. That's the next movement that should happen in dentistry, whereby we aren't just tooth carpenters and gum gardeners, but we actually are specialists of oral health at all levels. And we're able to screen through other factors that may relate to oral health, like diabetes, like sleep apnea, like gastric reflux, etc., and be able to communicate the knowledge that we gain to our patients to the betterment of their health and the whole nation. And so it was a challenge that was so strong that it was crystal clear to me, and this being 12 years ago. And so since that time, I've literally spent every day trying to learn everything I can about integrative medicine, which is looking at the whole person, and then how we fit in dentistry, which I would call integrative dental medicine. And so that's what we want to talk about tonight. And there's been many developments and discoveries and insights that we've gained over the last 12 years that have grown and grown and grown into a true movement, which now, through the American Dental Association support and proactive position, is going to become something that I believe will move all over the United States and be something that we in the Dawson Academy want to be ahead of the curve, implementing these things before others even are learning about it, as will happen over the next few years. And so I want to share with you some of the insights that we've gained and challenge you to join the movement, to get on this train that's already pulled out of the station and be a proactive leader in problem solving, which is always what Dr. Dawson spoke about, as well as being physicians of the masticatory system. And now I would add physicians of the masticatory system and beyond. We're looking at the whole person. So when we look at this picture that I'm showing you, what do you see? And I think most people would say, well, I see a great big orange dot. And that's true. But now watch this. If we erase the orange dot, what do we see? And you see that there's a big white square that was behind that orange dot. sometimes all we see is the orange dot and not some of the surrounding things. And I want to challenge us that that can be true as dental professionals who are trying to grow and looking at more beyond the teeth, beyond the gums. So let me give you a quick example. I had a 21-year-old female refer to me for TMD. TMD, of course, means anything above the shoulders that's bothering you. But her symptoms were sore muscles, clenching and grinding at night, morning headaches, chronic fatigue. She actually had gone to the emergency room last week because she woke up in the middle of the night with her heart racing and her chest pounding, and she thought she was going to die. She went to the emergency room. They did a workup on her and said, well, we think you just had a panic attack. And they gave her a prescription for Valium and sent her home. When she comes to see us, I have her open her mouth as wide as she can and raise her tongue as high as she can. And this is what we see. Can you see beyond the teeth and beyond the gums a potential for some major health problems that are observable in this one photo? Well, first of all, she's raising her tongue as high as she can. So what does that mean? That means that she has a severe tongue tie, which is highly associated with an airway, breathing, and sleep problem, concern, or potential. The other thing you see on her tongue is you see a scalloped border. And a scalloped tongue has about a 70% association with an airway problem as the dental arch is narrowed, usually because the tongue position has been low and they're mouth breathers in most cases. And this can be related to airway, breathing, and sleep disorders. Then as we look in the back of her throat, what do you notice? Well, what you notice is you can't see her uvula because it's halfway down her throat. She has what one anesthesiologist, Dr. Malampati, calls a Malampati 4, which is the most severe case of where the soft palate is down the hatch. And that is highly associated with a risk factor for airway, breathing, and sleep disorders. What else do we notice on the upper? You see an omega-shaped upper arch. The maxillary premolars are pinched in because the tongue has not been in the roof of the mouth, as we already observed indirectly through through the tongue tie. And so that's highly associated with airway, breathing, and sleep disorders. Another thing you wouldn't see immediately is she has wear on number 6, 7, and 8 into dentin, and yet she's only 21 years old. So she's been going out into edge to edge and crossover and bruxing. Why would you do that? That's not occlusion. That's not anterior guidance. That's not envelope of function. That's typically due to trying to get the airway open and the teeth get in the way. So when she showed all of these red flags, we did a quick overnight home sleep test that night to discover that her apnea hypopnea index was 34, and severe sleep apnea, the score would be 30 or greater. So she had undiagnosed sleep apnea that was severe and had been prescribed Valium, which would be a depressor of breathing, which would be actually contraindicated for her problem. So you see, we actually were able to intervene as gatekeepers of this gateway into complete health. And that's what I want to challenge us tonight to be thinking about, is that, are you a gatekeeper of complete health? Do you see the oral cavity as the gateway to the rest of the body? And there's a lot of information that can be gained through looking closely at the oral cavity and different conditions and understanding the relationship between oral and systemic health and systemic and oral health. And so I want to talk about why we would be interested in expanding our model of dental medicine. And I would say the whys would be this. Number one, we've got a problem. And I'm going to call this problem leaky syndrome, and I'll explain it to you. And it's a whole body problem that relates directly to oral health and disease. Secondly, dentistry is perfectly positioned to be on the front lines of integrative medicine or complete health. Thirdly, it's a better practice model. It's a better model for problem solving. It's a better model for positioning yourself and marketing your practice uniquely. It's a better model for a return on investment in your procedures and services. And finally, it elevates dentistry as a whole, and it elevates your practice to be the best in your community in addressing complete health concerns. And so, how do we begin to study this? And I would say there's three specific areas when we do a complete exam that we can thoroughly screen and test every patient. And these three areas are areas of detailed attention. I call them the three pillars of integrative dental medicine, and they are inflammation and infection, both locally and systemically, airway, breathing, and sleep disorders, and finally, TMD and malocclusions, which we in the Dawson Academy should be the most knowledgeable of any health professionals in the whole world. And so let's look at these more closely, understanding that as we study these three individual areas of attention, we find that they overlap, that often you'll find a combination of these factors, just like you saw in the young 21-year-old who had airway, breathing, and sleep disorders. She also had TMD and malocclusion. She also had inflammation that was manifested through sleep apnea and disorders that related to the release of stress hormones that were disturbing her sleep, causing muscle problems and headaches, etc. So we've provided for you in the past, and it's always available to you, this clinical checklist, which gives you the three pillars of integrative dental medicine. And then as we go down the column of evaluation, we look at several factors in each one of these specific pillars of signs and symptoms, clinical signs that you can find, and ways that we can screen and test. And then on the second page, there are treatment options for each one of these. So this is a great way for us to sort of calibrate ourselves to all be on the same page using the same criteria for evaluation. And whether you have a strong background or a weak background in this subject, using the checklist, you can begin evaluating your patients in a very thorough way. The objective is to take patients who have chronic inflammation that is causing accelerated aging and atherosclerosis and other problems, and to deflame the fire of inflammation to create an anti-inflamed aging process that is our challenge and which is our goal for each patient that we see. In my book, The Shift, I go through in great detail the checklist, item by item, why it's there, what it means, the scientific evidence behind its significance, and then what we do clinically. So if you want to have a reference for this, that would be a good reference to get you up to speed. All right, so let's look at the first pillar, which is inflammation and infection. What are we learning? Dr. Brad Bale and Amy Doneen wrote the book in 2018 called Beat the Heart Attack Gene. He's a physician, she's a nurse practitioner. They've recently written a second book called Healthy Heart, Healthy Brain. And in those books, they use this illustration of a tree. And on this tree, you see the fruit of the tree is atherosclerosis, or changing of the integrity of the arteries with plaque buildup, and the risk factor for plaque release and heart attacks and strokes. You notice that the trunk of the tree is inflammation, which is what I was telling you was emphasized at the meeting in 2012 at the Cleveland Clinic. And inflammation has become the buzzword in medicine and research of all the chronic Western diseases that we're dealing with. But also beneath that, you see all of these root causes where inflammation is not the cause, inflammation is an effect that causes accelerated aging due to inflammation, but that is not the root cause. It's just the signs and symptoms. The root causes go deeper, and some of those root causes are directly related to what's going on in the mouth, such as endodontic and periodontal disease. As we begin to look at this, we see signs of inflammation and symptoms of inflammation that may come from swollen, red, puffy, easily bleeding gums, and also things like decay and abscess teeth that can lead to periapical abscesses that are now infections where you have breakthroughs in the lining of the sulcus of the gum tissues and in the periapical integrity of the tooth, that now you have bacteria, pathogenic bacteria, that are now getting into the bloodstream. And so these are causing these are the root causes of what's going on at a larger level. So I'm going to call these leaky teeth and gums, meaning the integrity, the separation between the sulcus and where bacteria can migrate into the bloodstream has to have a breakthrough, just like you would break through a trampoline if you were bouncing on it and it broke, like you see here. And the same is true with decay, getting into the pulp, into the root, and down into the periapical area, where now you have infection that can get into the bloodstream. And so now we've got a chronic systemic problem coming from the mouth. Balin Doneen and David Vigorous wrote an article in 2016 that was the first article written in a medical journal talking about how periodontal disease generated by microorganisms can get into the general circulation and cause a bacteremia. They point out the fact that there are 5 key bacterial pathogens in the mouth. I'm going to abbreviate them and call them AAPG, TF, TD, and FN. These are the drivers of infection and inflammation coming from the mouth through periodontal and periapical infections and migration. And they talk about this causing what they describe as an inflammatory cascade that can begin to heat up the whole body into inflammation and migrate throughout the body itself. And so this is a key concept where now periodontal disease, as one example, can cause problems that migrate beyond the sulcus, beyond the pocket, into the soft tissue, into the bloodstream, into the bone, and even into the arteries, where now we're seeing the same process that you see in a pocket around a tooth happening in the lining around an artery throughout the body. And so we have an infection there. So this cascade now that gets into the arteries actually begins to cause biochemical changes. We have what are called inflammatory markers. And these are markers that can be observed through blood work, such as ADMA and C-reactive protein and myeloperoxidase and LP-plaque2, that are inflammatory markers that can be picked up on blood work that tell us there's inflammation present in the linings of the arteries that are putting this patient, whoever it might be, in danger, at risk for heart attacks and strokes and beyond. And so these are things that are observed now by really excellent physicians that we want to understand. We want to know about this. We want to get what's going on here at a body-wide level as we begin to analyze these things. So we'll call this, when we have a problem whereby now these bacteria can seep out of the bloodstream into the lining of the arteries and can cause plaque that can now burst like arterial acne. And when one of those pimples bursts back into the lumen of the bloodstream, it can actually cause a clot that, if it blocks the lumen, is what we would call a heart attack or a stroke. But you see, there can be a direct relationship between what's going on in the mouth, the inflammatory cascade into the arterial system, now breaking loose back into the arterial system to cause obstruction that can be fatal. And so heart attacks can be initiated in the mouth. And if that's true, we as oral specialists should be on the front lines preventing these things from being a factor. And so now here you see an article from the Journal of Internal Medicine talking about periodontal disease is associated with carotid plaque. And a person with periodontal pockets is expected to have larger carotid total plaque area. So this is medical journal type stuff that's out there. But I want to ask you, what's happening? You know, what's moving forward? What are we doing as a specialty in medicine to make a difference in this? What are we doing to treat it beyond just cleaning teeth and doing root planing, et cetera, where there's so much more? So we learn now as we go into the journals that are medical journals, molecular microbiology, journal of periodontology, et cetera, it goes talking about these bacteria getting into the arteries. Here's circulation, talking about heart attacks. And when you look at the clots of heart attacks, you actually find a large load of oral bacterial DNA in the heart attack clot. And in this one study of 101 acute heart attack patients, they found that 50% of those that they did panoramic x-rays on of the head region had one or more abscessed tooth. So periapical disease is a major issue for heart attacks, and oral infection, dental infection is associated with heart attacks, and dental health at the highest level now, I'm talking about advanced periodontal protocols, should be a major element of preventing heart attacks. So now we see leaky gums and teeth actually can lead to leaky arteries and can be associated with heart attacks and strokes. We've all heard about leaky gut, but even very few physicians can explain what leaky gut is. And what it actually is very much like the lining of your periodontal sulcus when you get leakage due to acidic bacteria, your AAPG, TFTD, and FN in the gut, in the intestines. Those bad bacteria, as you see illustrated on the upper right, can actually cause leaky connections of the junctions lining the intestines and cause the ability or allow these bad bacteria to pass through the lining of the intestines into the bloodstream. And now you've essentially got the same as periodontal disease in the gut. In fact, as we read articles, it talks about the pivotal role of leaky gum as an analogy of leaky gut to underscore the importance of the oral cavity and systemic health. And this is coming from the journal Cells in 2022, a medical research journal. So here we're talking about a breakthrough in the lining of the gut. We would call this leaky gut, and it's very much the same as leaky gums and teeth and arteries. And so we'll add that to our leaky observations now in the body that are related to oral health. Look at this. As we talk about heart failure and begin to look at the research, look at what I've circled in red on the left. It says increased bacterial translocation. Those are oral bacteria into the bowel wall, and going through the bowel wall can cause venous congestion and reduce cardiac output that can relate directly to heart failure. Over here on the right, we're talking about liver disease, and it's talking about bacteria seeping through the lining of the intestines into the portal blood to the liver, and now actually causing a gut liver dysfunction that comes from bacterial overgrowth and alteration of the mucosa and its permeability through these bad bacteria. This can be traced backwards to the gut. And so now we're talking about heart failure, liver failure being related to the gut, but also to the mouth. And so the final thing I want to show you, just for a brief overview tonight, is the brain and what's going on with brain health. And here we see an article that's actually 16 years old that talks about the fact that exposure to chronic periodontal disease quadruples an individual's risk of developing Alzheimer's. In recent years, we've learned more about why that is. The cells called microglial cells in the brain that are like white blood cells that digest amyloid plaque, which, as you know, is the leading buildup that causes Alzheimer's. When these microglial cells that clean up the amyloid plaque are exposed to oral bacteria that can cross the blood-brain barrier, they're stimulated to pay attention to the oral bacteria as opposed to the amyloid plaque, and you get a greater buildup of amyloid plaque because of the presence of these bacteria. So as we see here, antibodies and immune cells are designed to cross the blood-brain barrier, but now we're finding through research that oral bacteria can also cross the blood-brain barrier, creating leaky brain activity. And so it goes on to talk about bacteria colonizing the brain as a result of what? Periodontal disease. And this article from the Journal of Neuroinflammation in June of last year says they would describe this as leaky blood-brain barrier, identifying the impact of oral bacteria on the brain cells and neuroinflammation that's critical for developing targeted therapies for preventing these infections and inflammation processes that exacerbate Alzheimer's associated pathologies in people. So who's going to identify the oral bacteria? That would be us, the oral physicians. And so I want to challenge you that today's world, we understand medically that leaky gums and teeth can lead to leaky arteries, can lead to leaky gut, that can lead to leaky brain. And we're going to call this a syndrome that has not been described yet, but I'm describing it to you tonight. And we're going to publish on this soon, called leaky syndrome. And one of the goals of an anti-inflammatory life would be to reduce this leakiness that can happen throughout the body that starts in the mouth. And so we will be on the front lines. And so leaky syndrome is something that is prevalent. It's a pandemic where 80% of adults over 35 have some form of gum disease. 95% of those with diabetes have gum disease. 70% are more likely to develop Alzheimer's from gum disease. Up to 50% of heart attacks and strokes can be triggered by oral bacteria in the lining of the arteries. Up to 50% greater risk of cancer with gum disease. I could go on for an hour of the different risk factors. And so what I would challenge us as oral physicians is it's time to get mad. You know, we have a pandemic that's killing people in our families, in our neighborhoods, in our practices, and all over the United States. That really is something that should be, you know, addressed with as aggressive approach as we possibly can take. And I want to challenge us in the Dawson Academy that we be on that front line going forward. I couldn't be more passionate about this, as I know you can tell. So first thing is diagnosis, diagnosis, diagnosis. With this problem, our diagnosis starts with testing, and our testing, fortunately, is very easy, and it comes through saliva. We can identify the major oral pathogens of AAPG, TFTD, and FN through salivary testing. This is something that potentially we could test everyone for, but I would say we would start with patients with bleeding while charting or cleaning, with all patients that we're going to restore, or patients that we're going to place implants or extract teeth, patients that have other systemic health issues that are involving inflammation or risk factors for major chronic diseases. These would all be ones that we would consider. We're going to have a symposium in Charlotte in September. I'm going to describe to you at the end of this webinar. And Laura Hooper, who is the world's authority on salivary testing, is going to be on our team. 4 of us are going to teach that symposium, and Laura's going to be one of the key participants in that, that's going to teach you about salivary testing, advanced periodontal protocols. You cannot miss listening to Laura, and I hope that you will mark your calendar tonight to plan to be with us in Charlotte in September. When we see people like this patient who came in that was going to lose her teeth, was treatment planned for extractions and implants. When we looked at her salivary levels, we see that of those 5 high-risk pathogens, 4 were very elevated. I want to get those under control. I want to eliminate those even before we remove her teeth. That's why she's losing the battle with perio, even though she flosses twice a day, water picks, uses electric toothbrushes, having her teeth cleaned 4 times a year. And every time she goes in, her perio is worse, because you can't remove these high-risk pathogens by just cleaning the teeth or doing root planing. They're in the soft tissue, they're in the bloodstream, they're in the bone. And so we have to be very proactive and aggressive in order to address these with high levels of periodontal protocols, which we'll teach you. Diabetes is another example of systemic inflammation. Uncontrolled diabetes has been controlled to being like shards of glass scraping the walls of your arteries all day long. There's almost nothing worse than uncontrolled diabetes. And so the relationship between periodontal disease and diabetes has been seen to be bidirectional and something that we really should be addressing for every dental patient for their oral health, but also for their systemic health. We're learning about a lot of things that relate to diet that elevate blood sugar, and you can actually do continuous glucose monitoring now. There's excellent books like The Glucose Revolution by Dr. Jessie Inchaspe, who has given herself the title The Glucose Goddess. You can find her on Instagram. They're helping us to understand more and more about the role of nutrition and an anti-inflammatory diet and a diet that controls blood sugar levels as being a goal of not only systemic health, but also of oral and periodontal health. And so dentistry and nutrition should be the perfect marriage. This is Dr. Robert Lustig, who was one of our keynote addressers at our ADA symposium 2 weeks ago, one of the top physicians in the world on the subject of sugar and glycemic index and an inflammatory diet and on processed and refined sugars and carbs and oils and diets that's killing our Western world. And so Dr. Lustig is someone I want to introduce you to. He has many writings. He has a podcast. He has a website. I would encourage you to go check him out. And we're going to have him at a future meeting for the Dawson Academy that we will be inviting you to. But that's just a quickie of the subject of inflammation and infection. Let's talk about airway and breathing. We know that we've given a lot of attention in dentistry to obstructive sleep apnea and patients that we think of like the overweight, middle-aged, fatigued man. But we're learning so much about airway, breathing, and sleep disorders and realizing that this is a problem that can start at birth and most often does start in young children. And so we need to be able to know that and begin to screen for these things with our pediatric patients and understand that there's many signs that begin in the mouth. And that's where we're going to see first these changes of airway disorders and breathing disorders and sleep disorders. Dr. Harvald at Michigan at the dental school and the primate center there for human growth and development did experiments with rhesus monkeys where they put silicone plugs in the noses of these monkeys so they were forced to mouth breathe. And what they found was in one generation, all the experimental animals developed long, narrow facial appearances and dental malocclusions compared to the controls. And we see that today in humans where a normal development of the face would be a nice square jaw, high cheekbones, well-developed muscles of mastication. And yet we see more and more that look like Napoleon here that have the long face, poor muscle development, undeveloped cheekbones, open mouth, mouth breathers, and they're going to have dental profiles or facial profiles that instead of being normal like this would be more like this, where you see that regressive growth of the face, which is more and more common in the Western world and in the United States. And so this is dysfunctional craniofacial growth and development that can be driven by airway, breathing, and sleep disorders. McNamara at Michigan stated that there's a relationship between upper airway, that is nasal airway obstructions, such as allergies, and undesirable dental and craniofacial development related to mouth breathing, which is really dysfunctional breathing. And significant improvements are seen when the nasal obstructions are removed or allergies are corrected and the mouth is closed and nasal breathing is reinstituted. And so where are we going to be looking at this? Through dentistry, primarily, yet much more than in medicine. Dr. Christian Guilleminault at Stanford University coined a term, upper airway resistance syndrome, in young, thin people that came in with severe fatigue and poor sleep, but didn't have significant obstructive sleep apnea. What he found in his research was they had multiple partial to total breathing obstructions, not severe enough to be called sleep apnea, but that could lead to arousals from deep to light sleep and therefore poor sleep quality and symptoms that would present like severe fatigue, poor sleep, memory issues, etc. In one study where they had 30 subjects diagnosed with upper airway resistance syndrome, All 30 reported chronic fatigue. 28 said their sleep was non-refreshing. 26 said their sleep was disrupted at night. 17 reported morning headaches, something that we see a lot, isn't it, in TMD. 29 reported daytime performance impairment. When we think about our TMJ type patients that come in reporting to us that they're tired in the morning, their muscles are sore, they have headaches, we always think about clenching and grinding. But many of these patients that are the classic TMD patients actually are suffering from oxygen desaturations, from a turn on of the sympathetic fight or flight response, from an inflammatory cascade that comes from release of stress hormones like cortisol that can increase stress in the whole system, that can increase muscle fatigue, poor oxygenation, and also things like headaches and muscle problems. We've learned that in these cases, sometimes an occlusal splint, where we put more plastic, as it were, in the mouth, can sometimes make the problem worse. And so we're trying to learn all we can about this, because this directly relates to TMD, to malocclusions, to fatigue patients, to patients with headaches, to patients with sore muscles. As we look at this study that's talking about upper airway resistance syndrome and comparing it to patients that have mild to moderate sleep apnea or even moderate to severe sleep apnea, I want you to see on this bar graph that of all these somatic syndromes like insomnia and headaches and irritable bowel syndrome and bruxism and depression and gastric reflux and fainting and asthma, etc., that the column, which is the white column, that has the highest prevalence of symptoms would be those with upper airway resistance syndrome. The young fit female, for example, that comes in with all of these symptoms, and yet it's driven by airway problems, by breathing problems, by sleep problems, by oxygen desaturation, that is rarely diagnosed, just like the young female patient I showed you on the very first slide. But throughout our practice, we see these issues. Here's a man that came in to see me that wanted to have his anterior teeth restored because of the wear and tear that was occurring. And yet there's a couple of things that are red flags. First of all, look at his medical history: high blood pressure, cardiac arrhythmia, heavy snoring. Could he have sleep apnea? Look at his face. Big, thick neck. He looks kind of like a poster child for sleep apnea, if you ask me. Kind of mussed up, and. And then we look at his teeth, and what do you notice? He has wear on porcelain, facets on porcelain from chipping. And where is the chipping occurring? Not in his envelope of function, but edge to edge and in crossover position. We look in the back of his mouth, and where's his uvula? It's missing because it's down the hatch. He's a Malampati 4. He has slight scalloping of the tongue. He has all the signs of the potential for sleep apnea as the driver of all of these things, including his bruxism. We do a simple overnight home sleep test that night, and the report the next day is his apnea hypopnea score is 68. Severe is 30. This man is a walking heart attack. Is anybody else going to find it but us? I don't think so. And so, as oral physicians responsible for his oral health and beyond, these are things that we should be screening for on every patient. He has severe sleep apnea. We're going to work with a sleep physician. We're going to work with an ENT. We're going to work with an allergist. We may be doing some orthodontics or other procedures on a patient like this that is involved. Mark Cannon, a dear colleague and great educator from Chicago, sent me this email on January 1st, 2020. It says, my little brother Jim had a cardiac arrest Christmas Day. He went and spent the time with him in Texas, non-responsive. His pulmonologist arrived and told me very emotionally that his brother died from sleep apnea. The sleep test that he was supposed to have done was denied by the insurance carrier, as was the CPAP. Pulmonologist told me it was tragic and unnecessary. The CT scan showed massive brain necrotic areas due to oxygen deprivation. He died on life support at 59 years old on New Year's Eve, 2019. Here's what upsets me. You could easily do high resolution pulse oximetry in a dental office overnight and charge the patient less than $100 and know that there's sleep apnea. You could do a home sleep test for a couple $100 overnight tonight and find out that he definitely had sleep apnea. But no, we have to go through all the hoops and bells and whistles of getting approval and going to a hospital and spending the night in a sleep lab and then being prescribed a CPAP and all of these things. Just it may take months unnecessarily when we could do an overnight study tonight in a dental office, and it would be very appropriate. At our upcoming meeting in uh, Charlotte in September, Dr. Jim Metz is going to be with us. He is the leading authority on high resolution pulse oximetry and has developed the testing and software interpretation, which he's done thousands and thousands, and treatment of these patients with either obstructive upper airway resistance syndrome or obstructive sleep apnea. So if one of these young 21-year-old fit females came in saying, I have headaches, sore muscles, I'm clenching and grinding in the morning, first question I would have is, could there be an airway problem? Then we would do an overnight high resolution pulse oximetry, which does not require a physician's interpretation. And if we got a report back showing this software, whereby we're just looking to say, are they in the green for respiratory distress index or sleep fragmentation? And as you see the red circles here, it's green, 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 green. We could say, nope, she's okay. She doesn't have an airway breathing or sleep disorder. And the second patient who may come in looking exactly the same, we could do the same overnight home sleep test. And what we find through this high resolution pulse oximetry, as you see in the right two columns, we get into the red areas. So now we've got some red flags that say, there is something going on. Could this be upper airway resistance syndrome? Could that be the driver behind these symptoms, behind this poor sleep, behind these headaches, behind this bruxism that's going on? That would be the key question to ask at that time. And so here's an example of one case that Jim did using an oral appliance that he developed. And here's where the patient started. And after 15 months of treatment, you see that the patient is in perfect condition as far as green, 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 as far as airway breathing and sleep. And so that's where dental procedures such as this can be involved in treating medical problems very effectively. Another thing that I would throw out there that you could download on your phone app right now would be Store Lab. It's a great lab, a great app that's free. I'll show you something I did on myself, and I use this on patients all the time. Here's a study I did on myself one night, Sunday, August 27th. What you see is empty mouth sleeping, and you see the bars there that represent snoring, and the orange is high volume snoring, and then it gives you a score. My score was 54, which would be kind of moderate snoring. The next night, I just simply mouth taped, and my score came down to 28. It cut in half my snoring, and you can see the volume is greatly decreased. The next night, I added an oral appliance, which was a forward positioning of the mandible, along with mouth tape, and my score came down to 12. 3 nights later, on Friday night, September 1st, my score was 7, and you see almost no snoring. This is an objective way to evaluate something that we're doing for patients that involves dental procedures and medical procedures, things simple like mouth taping, mandibular advancement appliance, and we can actually see whether it's making a difference or not. There are other things that are being done, such as expansion of arches using TADS appliances, tongue release procedures, now even laser soft tissue management, which we've been experimenting with in our office to shrink the soft palate and open up the posterior airway. And there's been some very effective results doing that. Another dental procedure that you can learn about. I want to share as we begin to wrap things up, Dr. Gina Pritchard, who is a nurse practitioner with a doctorate in cardiovascular risk, has been teaming up with myself and Dr. Laura Hooper and doing research on this whole subject of integrative dental medicine and integrative medicine. Gina is a specialist in cardiovascular risk prevention, and so we've collaborated together over the last nearly 4 years now, and we've begun to see some things through research and our clinical studies about the relationship between when there are airway, breathing, and sleep disorders, you're going to have an increase in oral pathogens. You're going to have an increase in periodontal disease. You're going to have an increase in movement of these high-risk pathogens, AAPG, TFTD, and FM, into the bloodstream, into the gut, into the arterial walls, increasing the risk for heart attacks, increasing the risk for Alzheimer's, increasing the risk for liver disease, kidney disease, etc. And so we talk about mouth breathing and how it increases anaerobic oral pathogens that can increase leaky syndrome, both vascular, gut, brain, organs, peripheral vascular disease. When we meet at our symposium in September in Charlotte, Gina Pritchard is going to be the other member of our teaching team. So it'll be myself, Dr. Jim Metz on sleep evaluation through high resolution pulse oximetry and oral appliance therapy. Laura Hooper on periodontal pathogens, on advanced periodontal therapies, and we will put together a program for you on airway and teach you about that and how we can use testing at night on pathogens and how we can use salivary testing for that, and on plaque, and how now we're looking at CIMT, which is carotid intima media thickness. We're looking at the arterial walls of the carotid arteries in the neck and beginning to evaluate for risk of coronary artery disease. So inflammatory disease processes, looking at these things, looking at these inflammatory markers, realizing now that myeloperoxidase is highly associated with tooth abscesses, that LP plaque 2 is highly associated with periodontal disease, that ADMA is related to nitric oxide deficiency that can be related to breathing disordered sleep. All of these things are things that we can address through integrative dental medicine, the study of dentistry's role in complete health. And so TMD and malocclusion, I'm not going to go into right now, but we will, looking at how often these start at early ages, related to a strong correlation between oral breathing and malocclusions, and how these things can be a vicious cycle that can lead into other systemic problems that can be very serious. So we're looking now at the factors of inflamed aging, that is accelerated aging due to inflammation, and we're thinking about oral pathogens, periodontal, periapical issues. We're thinking about leaky syndrome that can start with leaky gums and then go into the arteries, the gut, the brain, and other organs. We're thinking about blood sugar dysregulation, how that can relate to nutrition, to sleep, to stress, to physical inactivity. And we're looking at airway, breathing, and sleep disorders and how that can affect dental occlusion, TMD, gastric reflux, and then finally airway to pathogens to plaque. And so what I want to invite you to are two things. First, I'd like to expand on the TMD malocclusion component this Friday. So this Friday, July 12th, from 9 a.m. to 12 a.m. we're Eastern time, we're going to do a Dawson Academy live stream on principles of TMD, airway, and malocclusion. I'll take you through 4 lessons in 3 hours on understanding TMJ anatomy, joint anatomy, function and dysfunction, understanding causes and effects of TMJ dysfunction, understanding the diagnosis, including imaging of TMJ disorders, and then understanding the treatment of these things. So I want to invite you, if your calendar is available, to mark it off for this Friday from 9 a.m. to 12 a.m. Eastern time and join us for this live stream. And then secondly, what I've been talking about throughout this webinar is what I really want to promote tonight the most, and that is our upcoming symposium, our Dawson Academy Airway, TMD, and Inflammation Symposium. We've been having an annual airway symposium up until COVID, and we've had one since. I want to combine that airway symposium this year with TMD and especially inflammation, and bring in our colleagues Jim Metz, Gina Pritchard, and Laura Hooper, all of whom are, I consider, the world's authorities on their specific subjects of high resolution pulse oximetry, oral appliance management of sleep apnea, uh, periodontal pathogens, uh, periodontal systemic connection, and then also the systemic inflammation connection with Gina Pritchard. So this is going to be a packed 2 days. And what I want to emphasize, and I promise you right now, it'll be emphasizing is implementation. What are you going to do on Monday morning after you're there with us on Friday and Saturday, September 20th and 21st? What will you be able to go home and do on September 23rd that will begin to build out this model of problem solving for you as a Dawson Complete Dentistry dentist that is the go-to dentist in your community? So I want to urge you to see this as a valuable opportunity, a once in a lifetime opportunity that I have specifically tailored for the Dawson community. And I want to urge you to be part of that, encourage you to be part of that, and promise you that it's going to be something, really, really wonderful. And so please join us for that.